Hello, everyone, and welcome to the first teleclass of 2023 and the first teleclass using our fancy new streaming system and the first of three Didier Pittet teleclass lectures this year. This one is using humor in infection prevention. Now, I'm not sure what I can say about this man that you haven't heard already. By my count, he has introduced 30 he's been introduced 30 times for 30 teleclasses, and if you missed any of those, you would have heard his TED Talks or his lectures at conferences or a thousand other places. You know about his monumental role in the promotion of hand hygiene around the world and his commitment to hand hygiene and hospital sanitation. Professor Pittet was made an honorary commander of the Order of the British Empire in 2007, which is an enormous honor. He has been awarded the Robert Koch Prize and the Louis Pasteur Medal. And in 2020, he was appointed by Emmanuel Macron to chair an executive assessment mission to address the coronavirus crisis. Professor Pittet is one of the most respected scientists in the field of epidemiology in Switzerland and around the world, and he has been a great champion of teleclass education, and for that we are very grateful indeed. For the next hour, he is going to talk to us about the use of humor in infection prevention. Didier, thank you for joining us again and for heading up the 2023 teleclass education schedule. It's over to you.
Thank you, Paul. It's a real pleasure to be with you again at this beginning of the year 2023. Let's sort of start with the using humor in infection prevention. It's a pleasure for me to be with all of you today. So the plan for today is following on the screen: humor in hand hygiene from the early 90s, effects of humor in advertising, humor in healthcare, how to use humor in infection prevention, or IPC if you like, humor in scientific publications, humor in media, and humor in community. Uh, a way for me to discuss humor in preventing diseases, and in particular in the field of infectious disease and infection prevention. So let's start with humor in hand hygiene from the early 90s. And you are very familiar with the type of cartoons or humor I've been using since then. I used to say, "Welcome to the hospital. Infections are waiting for you at the entrance door of the hospital, and unfortunately will complicate your hospital stay." Looking at all these microbes all over the places, and these patients coming to be admitted to the hospital, and certainly suffering, unfortunately, in 1/10 times, 1/5 times, 1/20 times of healthcare associated infection. Importantly, hand hygiene, which is again suggested by these hand washing, this microbe that seems to suffer from the role of soap and water. Hand washing is and was and has been traditionally the most important way to prevent healthcare associated infection. Are we into humor or not? That's the question. The next slide remind you that hand washing is to be considered as an action of the past from the early 1990s, except when hands are visibly soiled, and that alcohol-based hand rubbing is to be considered the new standard of care, or was actually at the origin of the so-called hand hygiene revolution. Is it humor or not? Well, it's certainly based on evidence, but in this case, we are using cartoons with a little bit of touch of humor in order to promote the good hand hygiene or the good hand washing, depending. Now, this is also what you call system change. We changed the system. We moved from soap and water hand washing to alcohol-based hand rubbing. Now, remember this alcohol-based hand rub bottle that we used at the University of Geneva, this pocket-sized bottle? that we introduced in 1995, many years ago, nothing to say, together with this instruction. Use it before and after any patient contact, after glove use, in between different body side care. These were the ancestors of the 5 moments for hand hygiene. Again, this bottle was sort of used with this cartoon to promote behavioral change. Now, importantly, before and after the use of alcohol-based hand rub is suggested by this cartoon, which is not humor, but this is certainly using a way to speak to you. And this is a way we use to promote education, a different way to educate healthcare workers, as you may understand. We use the walls of the hospital in a technique named the talking walls to promote this behavioral change. And when you go and see closely these walls in the hospital, you see here, it's in French, and doesn't matter. It means that microbes are like represented in a way people could understand, in a way everyone could understand. And in this case, hand rub is the natural killer of cross transmission, to insist on the fact that the use of alcohol-based hand rub is a key to kill microbes that, as you can see on this slide, seem to suffer from the use of alcohol-based hand rub. Well, the next slide shows you my son. If they don't get me, you will become multi-resistant. He's telling Father MRSA to little son MRSA. Is it humor? Is it not humor? Is it education? I don't know. I know that people are smiling looking at the picture, and I hope they will be impregnated by this image so that they understand the role of antimicrobial resistance into our daily life and the role of preventing these from happening. The next slide shows you dirty stuff, the way we called MRSA in a very lay language out of hospital. These are workplace reminders. Those workplace reminders that we used in the early 90s in order to tell healthcare workers about the importance of healthcare-associated infection and the importance of intervention and action in the field of hand hygiene promotion. Progressively, our bacteria became frightened by our action, soon going to Sigmund Freud, telling to Sigmund Freud, Dr. Freud, in this hospital, it becomes impossible to cause infections anymore. Well, is it humor? Is it not humor? I don't know. But what I know is it helps promoting a change. Geneva University hospitals against dirty staff. War has been declared. Well, importantly, this last image is telling you a lot about safety culture. It is telling you that with the use of drawing and some sentences that are impregnated through humoristic vision, you can actually facilitate a behavioral change. The next slide shows the results of our first 3 years of hand hygiene promotion at the University of Geneva hospitals, published in the Lancet, in this case transforming the data published in the Lancet into a drawing cartoon, where you see that compliance with hand hygiene is increasing over time, mostly due to the increased recourse to alcohol-based hand rubbing. And as you know, we used it for monitoring and performance feedback, because those cartoons were used in order to mobilize healthcare workers around their performance so that they can improve their performance. Importantly, all the images I showed you were included in a multimodal behavior change strategy using system change, education, monitoring and performance feedback, workplace reminders, and safety culture in order to promote hand hygiene at the University of Geneva first, and then all over the world. Now, hospital-wide nosocomial infection trends between 1994 and 1998 at the University of Geneva dropped. They dropped by 50%. And this cartoon show you this microbe disappointed by the fact that rates are going down. Is it humor? Is it a way to communicate? I don't know. But what I'm telling you is that nobody ever forgot those images. Importantly, we could demonstrate the cost effectiveness of the strategy because for each 1 franc or $1 or €1 invested, the return on investment would be 25. And that's why this summary figure, after 8 years into the campaign, is summarized by one sentence: rub hands, it saves money. So, of course, rubbing hands not only saves money, it saves lives, it saves the use of antibiotics, and so on and so on. But the take-home message here is pretty clear. Now, importantly, the effectiveness of our hospital-wide program to improve hand hygiene has been published in the Lancet. It was called the Geneva model of hand hygiene promotion. It was reproduced with success in different hospitals, in multiple hospitals around the world, and in national promotion campaign. Now, let's move to the second aspect after I discussed the use of humor in hand hygiene promotions from the early 90s. Let's talk about the effects of humor in advertising. Well, in advertising, it is demonstrated that A, humor is an effective method to attract attention. B, using humorous and positive messages encourage and promote behavior change and knowledge acquisition. And C, humorous strengths or humorous attention gaining mechanisms and humor message relatedness have a positive impact on memorizing the message. And that's very, very key. And I encourage you to access the Journal of Advertising published in 2007 regarding those issues. Now, this is clear that the effect of humor are important in advertising. What about humor in healthcare? Is it used? Is it useful? What do you think about it? Well, humor in healthcare, preventive health campaign. Humor-based materials are used effectively in preventive campaigns to prevent alcohol and tobacco consumption, obesity, and cancer. So it's a widely used in healthcare. It's used to draw attention, and it has been proven to draw attention. It's used to reduce negative emotional responses, such as fear, anxiety, and embarrassment to disturbing health topics. And it's used to increase acceptance of health messages and behavior change. So clearly, humor in healthcare is used in preventive campaign, and that's important. How about the use of humor in infection prevention and control, or in IPC? Importantly, how humor can be used in infection prevention and control is to be discussed. Let's see in training first. IPC training, by the use of the same messages and teaching materials, may result in healthcare workers feeling bored and over-messaged. We all have seen it in our daily life in hospitals. Traditional training may also cause less comprehension of the key messages. So it's important for us to renew our messages and find new ways to promote. Educational games and creative hands-on activities can be used in IPC training to stimulate sustainable learning and team spirit. This is very, very key. Now, let me give you some examples. Here is the example of an interactive audit and feedback strategy for hand hygiene that was implemented using a card game in a large academic center. It's called a splat game for hand hygiene. The splat cards were provided to staff at the beginning of each shift. They handed the card out as gentle reminders when they observed peers or colleagues not performing hand hygiene. So the first person on each shift to give all their cards away and not obtain any card in return was offered coffee gift cards donated by the medical director. Very, very simple game, right? Doesn't cost anything. What about the results? After implementing the game, and you see here, these represented for nurses, nursing assistants, physicians, and therapists. After implementing the game, hand hygiene adherence increased from 87% in 2017 to 90% in 2018 and continued to improve. C. difficile infection rates decreased from 17% 6 months before the intervention to 3.7% 6 months after the intervention. So this is a good story. It's a very nice example, as you can see, of a very, very simple interactive game that was ludic, using some sort of humor approach that seemed tremendously interesting. Other examples: as part of an education session at St. Joseph's Health Center, staff had to remove their gown and gloves without getting any of the pudding on their skin or clothes underneath. The game was meant to mimic the potential for transmission of bacteria by healthcare provider. It was called the PPE pudding game. I like it. I like it. I really like it. Look at the smile of those people performing the PPE pudding game. What a story. What an innovation. Congratulations. Some other example: at the University of Geneva hospitals, we created an Escape COVID-19, a serious game to actually promote safe IPC practices among healthcare workers and other hospital employees during the COVID-19 pandemic, and encourage all of you to access actually our paper published in GMIR Serious Games in 2020. And you will see that this is a very interesting way to promote attention and to obtain improvement in adherence to good IPC practices. How humor can be used in IPC? What about awareness-raising campaigns? Humorous material, example posters, reminders, screensaver, may help to capture healthcare workers' attention. And I encourage all of you to access those papers and websites. It's clear that awareness-raising campaigns using humor are very well received and usually quite powerful. Some example: in this case, nudge reminders based on well-known song lyrics have been developed, and they were in order to improve hand hygiene. Hand hygiene compliance significantly improved from 31% to 68% in 10 words with the new reminders and multimodal hand hygiene promotion strategy. This has been published in the Journal of Infection Prevention. And you see on the graph the compliance in May 2018, the compliance in November 2018, and again in February 2019 in 10 different words, as well as the overall compliance. So a very interesting approach of nudging impact. Other examples: using emoji tunes. Emoji tunes are created using actually avatars of employees to remind the key IPC practices to the healthcare workers. They are designed to give a brief information at a short time to actually make easy to remember the topic. So in this case, look at the cartoons. Every time I go to check, the tube has slipped and created a dependent loop. Here is a tip. Use the green clip. Next slide. This is how to avoid a slip by using the clip. The results were that 50% in compliance, increased in compliance detected on key IPC practices. See, a very, very, very simple way to promote good practices, obviously, in this case. I encourage you to access the website where those avatars and emoji tunes have been created. What about environmental hygiene? Look at the cartoon. I have gathered all my knowledge and have come to the conclusion that you will be sent to hospital quarantine. Kind of a nice cartoon, right? Now, importantly, patient area environmental surfaces play an important role in the transmission of all healthcare associated pathogens, right? Also, both hand hygiene and environmental hygiene represent basic horizontal interventions to prevent cross-transmission. There is a need for both interventions to be recognized as independent. Several technological interventions to augment environmental hygiene have been recently developed but remain to be objectively evaluated in well-designed clinical studies. So this is a way to make environmental hygiene interesting, yeah. The next slide is again about environmental hygiene to remind you that according to a 2022 systematic review that we conducted and published, the references on the bottom part of the slide, improving healthcare environmental hygiene helps keep patients safe. Most studies demonstrated that intervention in the hospital environment were associated with lower healthcare associated infection and patient colonization. So definitively very, very key, and feel free to use this cartoon, this image as much as you want if this one will help you to promote good practices. Now, Oregon Patient Safety Commission use Humour for training of environmental staff. Staff working at handling and cleaning the environment in our hospital need to be trained, right? So in this case, environmental cleaning and disinfection in dialysis on the left-hand side. On the right-hand side, norovirus training for environmental cleaning staff. Initially, deep cleaning restrooms, general areas increased to twice a day. Patient rooms and restroom increased to 3 times. So they're very simple cartoons to remind you about good practices. Center for Diseases Control and Prevention, CDC, in the USA, has been using this approach too. EVS and the Battle Against Infection graphic novel. EVS and the Battle Against Infection on the right-hand side by CDC. And look at those cartoons. Window number 8. Do you know who the most important workers are in a hospital? You would think the answer would be just doctors and nurses, but the answer is everyone. All healthcare workers, including EVS workers, work together to help create a safe environment that promotes patient healing and recovery. Window number 9. Our job is infection prevention and control, or IPC. Our IVS team is the first unit of defense, first line of defense against germs in the hospital, especially those that are resistant to antibiotics. So these are very, very important cartoons because we used not to speak about it, and now we are talking about it. Again, images from CDC from the same series. As you can see, I added another another one on the right-hand side, 13 and 14. The visible things to clean are the trash can, the dirty ceiling, the counter, the floor, by the chair, or the spilled drink. However, what you see is only part of the problem. Take a look at the places where you may not see germs. Well, let me tell you, these cartoons by CDC, and there are many more, are very, very important. It means that we are moving to a new way of teaching. Environmental cleaning during COVID-19. Let's look at these. Hashtag I am a healthcare hero, as you see on the bottom part of the slide. You are cleaning this area once every hour. Looks spotless to me. The virus can be seen, so we can only clean harder. But it's nice, it's simple, it's nice. We need to think about it. We need to use this type of way to speak to our healthcare staff and personnel. The next slide shows you humor and infection prevention and control. If you go on Google and you look at these, and here is what you will find. Many, many, many examples from multiple sources could be identified by simply looking at Google, and other examples looking at gadgets and tools and so on and so on. You can go and find and buy some gadgets and tools in the field of humor and infection prevention and control, and this is very, very important. There is also a Pinterest site that has been developed, actually, very interestingly, by Sally Salter to get ideas and material. Just go on this Pinterest site, and it's a nice way of sharing nice images, nice ID, nice examples, and so on and so on. You are probably aware of the film festival promoted by EPIC. It's not only humor, but it's also using humor. Film festival uses humor and education to promote infection prevention. So I'm encouraging all of you to think about this new approach that is not that new, but can be renewed all the time to promote good IPC practices. Now, how humor can be used in IPC? You can run contests, posters, photos, song, video, dances, and so on and so on. Here are some example contests for IPC activities that motivate frontline staff to show their enthusiasm, creativity, and team spirit. You see me singing, in this case for Clean Care is Safer Care, it's all in your hands. You see hand hygiene dances, you see hand hygiene angels, you see all sorts of things. So feel free to use your creativity and to promote the creativity of others. Here is the example of a photo contest on the 5th of May, 2022 in Geneva hospitals. And as you can see here, people are free to develop all whatever they want. Here is another example in Germany. In a national campaign, you see on the right bottom part of the slide, this is an official poster that is used in the National Hand Hygiene Promotion Campaign, where you see this alcohol-based hand rub dispenser reminding this doctor to clean hands before using gloves in this case. Olaf is a very, very peculiar and popular figure in Germany, and this is really important to understand that in this case, humor is used to promote behavioral change. Now, what about humor in scientific publications as a next topic? I have no time to further develop these, but it's clear that it has been used. In this case, we have been using it. Keeping hospitals clean is a crucial patient safety issue, as shown and suggested by this slide. I can tell you that many people have been asking me for using those slides, and I always tell them, feel free to use those slides, obviously. Feel free also to develop your own slides and using your own humor, using your own colleagues able to develop humoristic vision. Now, on the right-hand side, bad science impact public health is also a very important take-home message. Now, the use of creative and humorous designs as vehicle for health, education, and infection control has been the topic of some research. In this case, we are talking about a publication that was submitted and published on the occasion of the third ICPIC conference in 2015. ICPIC that is held in Geneva every 2 years. We'll come back on these. I encourage you to access the paper published by So and colleagues in Eric in this case. What about the next issue, which is humor in media? Well, as you know, humor in media can be used. In this case, translated from French, standard precautions are efficacious and cost effective, right? Very important. Standard precaution. Let's speak about it. Of course, it's a boring issue for many people, but when you translate it using a humoristic approach, it changed everything. And in this case, this is a great example of, for those who know Titoff, Titoff is one of the most popular cartoon figure, at least in Europe, but also all over the world. And we use Titoff in order to promote behavioral change during the COVID pandemic. And we started very early, as of March 2020, using humor to change behavior. The next slide is telling you humor in media. In this case, that was during the first wave of COVID. You know, we were using these COVID certificates in Switzerland, and people were going around and telling, for sure, this is a copy of a Didier Pittet. Well, it's a way to sort of speak about important events like past certificate using a humoristic approach. Other figure on the right-hand side, there are consequences if someone on the floor doesn't wash their hands. So, well, it's a very nice cartoon, right? It's a very nice way to say, okay, let's not take it easy, but speak about it a way that makes it a little easy. SARS 2002. This was in the newspaper. Get my SARS mask quickly. I have to talk to our Hong Kong office. He's telling this CEO to his personal assistant. Well, this tells you a lot. This very simple cartoon, together with this very simple sentence, is telling you a lot about the stupid things that may be thought about, but it's a way to make sure people understand very well what is the most important take-home message. The next slide is to discuss about humor in the community. We have been discussing humor in hand hygiene, effect of humor in advertising, humor in healthcare, how to use humor in IPC, humor in scientific publication, humor in media. And now let's look at humor in the community. Well, that was in SARS time again, in 2002. Was it humor, really? Well, today it looks funny. Yes, at the time it even looked crazy in 2002. Now that we have been in 2000, from 2020 through COVID-19, it looks a little less strange than it used to be in 2002. At that time, it was humor. Today, it would be considered differently. Similarly, and this is on the next slide, you see humor in the community. First case of H1N1 2009 in the Paris area. Let's magnify the image, as you can see. Yes, it was humor. It was a way to tell people that you should not be upset about any simple bird that you find on the floor that looks strange or look dead in some case, and not panic about everything. But clearly, it was using humor for educational purposes. Well, I think that it is important at this step to try to make a little summary of what we discussed today. To me, it is very clear and very important to realize that advertising has been teaching us a lot for many, many years. I could give you 100 more examples of what you can find in the literature in order to explain to you how much I could use or we could use humor to change behavior. Now, let's look at what we learn and let's try to discuss if this is the case in our field. Number one, humor is an effective method to attract attention. And this is very, very, very clear. To me, I have been using humor for the past more than 30 years in order to promote education in healthcare, in medicine, in infectious diseases, in infection prevention and control, and in public health. In other words, the use of humor helps you to promote and to educate, to change the behavior of people. You need to tell them something new is happening. You need to tell them something differently than they use to get your message. Today in infection control, we need to find a way to make sure people are following us. And even more than these, are creating their own spirit around infection prevention and control so that this discipline and this domain becomes something that is part of their daily life. We are not the one to perform hand hygiene at the point of care every day so many times, right? We are the one to help people reminding that they have to have a good behavior. So that's why using effective methods to attract attention in IPC is so important. And that would be one of my main take-home message. You need to attract attention, and humor is an effective method for these. Second conclusion, using humorous and positive messages encourage and promote behavior change and knowledge acquisition. It's very clear that we need more research in the field, but it's very clear too that positive messages are received totally differently in the field of infection prevention and control than many other ways of transferring messages. It's very, very clear that by using humor, people could look at you differently. And I know about it because I've been using humor for many years. As I said earlier, for more than 30 years, I've been using humor in order to make sure the message will go through. Make sure the message, even if the message is negative, understand you don't clean your hands as necessary as it's needed. So it's not a fancy message. It's a strong message. It's a reproach. But giving this reproach using humor helps. It helps people say, okay, I agree. I need to do better next time. So in this case, it helps to encourage and promote behavioral change. It also helps to actually improve knowledge recognition and knowledge acquisition. You know, acquisition of knowledge is complicated. You need to sort of find a way to tell people that they have to learn it. So to tell people, be careful, I will tell you something important, is a lot less powerful than coming to tell them with humor what you want to tell. So, number one, humor is an effective method to attract attention for sure. Number two, using humorous and positive messages encourage and promote behavior change and knowledge acquisition in many fields in our life. And number three, humor strengths and humor message relatedness have a positive impact on memorizing the message. And this is very, very key because, as you know, memorizing a message today is the most complicated to get. Why is it so complicated? Simply because we have so many things happening around us. There are so many things that are promoted to us. There are so many messages that are coming to us every day. Think about your emails. Think about the letters that you receive. Think about the messages that you receive all the time. So basically, psychologists have said that we receive too many messages today. So it becomes difficult to memorize messages when you receive too many messages. So humor strengthens the capacity of making you see things differently, of having the emotion part of the message you receive is very key. And the strength of humor is actually transforming the way you got the message in a way you could memorize the message. And this is absolutely key. Humor message relatedness is extremely positive on the way you memorize the message. So think about it today in your practice in infection prevention and control. In advertising, it's very clear. A, humor is an effective method to attract attention. B, using humorous and positive messages encourage and promote behavior change and knowledge acquisition. And C, humor strengths and humor message relatedness have a positive impact on memorizing the message. So also we lack science still in the field of IPC, infection prevention, whether it's preventing good practices or doing antimicrobial stewardship, whether it is changing behavior or changing the way medications have been prescribed. It's very clear that humor can help if this is well thought and well conducted. Last but not least, of course, the impact of humor on compliance with optimal IPC practices deserves more research. Why? Because, like everything in evidence-based medicine, we need first decent, then good, then outstanding research to be conducted. Why? because it's always difficult to conduct state-of-the-art research on some difficult topics. Because in infection prevention and control, everything is multimodal. So multimodal strategy, of course, do not only use humor. If I come back to my first example of promoting hand hygiene, we used a multimodal strategy made of 5 different elements that you all remember. System change, the use of alcohol-based hand rub at the point of care. Education based on new cartoons and way to change behavior. Monitoring and performance feedback. Posters, gadgets, and reminders, and so on, and safety culture. So a multimodal strategy where humor has a place. But this is not to say that humor only will change and improve hand hygiene. Not at all. What about using humor without using alcohol-based hand rub? Doesn't make sense, right? What about using humor without monitoring performance and feedback? What about using humor in a field where patient safety is not there? You have to understand that in infection prevention and control, as I said early, everything is multimodal. So as part of multimodal strategy, yes, to me, humor is an effective method to attract attention. Using humorous and positive messages encourage and promote behavior change and knowledge acquisition. Humor strengths and humor messages relatedness have a positive impact on memorizing the message. So it's clear that it will help you use humor for you to remember the best action to perform. And it's also clear that the impact of humor on compliance with optimal practices deserves more research. So I hope that in these 4 elements that I gave you, you will all be encouraged, A, to think about using humor to attract attention and make sure people get the positive message, and B, to eventually imagine to study the impact of humor using appropriate methods and research approach. Now, to me, however, despite the fact that we are still lacking the best science, it is very clear that humor can be used as a powerful tool for delivering key infection control messages in a memorable and engaging way. So that would be my main conclusion for today. So I would encourage all of you to actually think about the way you are doing your activities in your everyday practice. Think about the way you try to obtain a change. To obtain a change, you first need to attract attention. You second need to encourage the best behavior and knowledge acquisition. And thus, using humor could help you in attracting attention, obtaining a change in behavior, and getting your message memorized by your friends and colleagues, healthcare workers, and health staff. And in those conditions, using humor can definitely be a powerful tool for delivering your key infection control messages in a memorable and engaging way. So I know that we are lacking research, evidence-based research, but I'm totally convinced that we should study it and we should use it the best we can do. Now, in the next slide, you see a day without laughter is a day wasted by Charlie Chaplin. Charlie Chaplin was a Swiss humorist, as you know, probably one of the best ever. He was working at pleasing everyone at a time where actually movies were in their infancy, at the time where the soundtrack were not good enough. There were even no soundtrack in most of the Charlie Chaplin movie. And already at the time he said, a day without laughter is a day wasted. We all know that laughing and humor help us remember. We all remember our best time laughing together with friends, laughing together with colleagues. And this is very, very key. And to me, this really deserves an area of research. And I will encourage sponsors to promote this type of new way of changing behavior in our daily practice. With these, I'm about to conclude this talk for today. I won't conclude without remembering you that in 2023, this year, we'll have, like every 2 years, our international conference on infection prevention and infection control in Geneva, in Switzerland, between the 12th and the 15th of September 2023. This conference is nowadays the most international, the most attended conference in IPC, where the best abstracts are submitted in our field. I encourage all of you to attend. If you need support to attend the meeting, when you submit an abstract, you just indicate that you want and you need support. And for all of those with abstract accepted coming from developing countries and low resource countries, you will get support to attend the meeting. This is the 7th meeting, ICPIC meeting in Geneva. And as you know, Semmelweis, as a hand hygiene promoter, is always extremely present in this meeting. And I encourage all of you to do it. It is done in the context of the Clean Hospital strategy that I'm running from Geneva as the second part of promoting hand hygiene and promoting actually in environmental hygiene in infection prevention and control. For those who are interested to follow our activities, please access our website, follow us on Twitter account of myself, the Clean Hands, the Clean Hospitals. You see clean dash hands or underscreen hands, clean underscreen hospitals. You can access our website, cleanhandsavelives.org. You can access our website at Clean Hospitals, cleanhandsavelives.org. And it was for me a real pleasure to have you on board. And with this, I will turn back the microphone to Paul Weber, thanking you for your attention today. Paul, thank you very much.
Didier, thank you very much. As always, it was a very interesting talk. The fact of the matter is, humor sells. I think that was a big part of your talk. Humor sells products, humor sells ideas. And if you go to the conference, any conference, the speakers who use humor in their speeches really get the best ratings. And the advertising that uses humor is obviously the most memorable. Now, you indicated that there are humorous aids that are available now for people to access. Weber Training website has more than 100 posters that are available for free that use humor. Where's the best place that you know of to get other resources?
Oh, very good question, Paul. I'm glad to hear about those posters, and I think that we could certainly send to the Weber Teleclass participant the access to those posters. You find some on the internet. Clearly, if you look at systematic review, we still have our posters promoting hand hygiene available on the so-called Hopi Safe website. So Hopi, HOPISAFE.ch website, where people can find our original poster materials that are made for free for everyone. What is very interesting is that people are so original today. You have many people who can develop their own material. So I will not be afraid of empowering healthcare workers at thinking about using humor in infection prevention and control. When you do contests in hospitals, you have a lot of people coming, and you see gifted people coming to you. You would never imagine those people being so gifted using humor and behavior. But you are right. We need probably to centralize those materials so that they can be used worldwide. Importantly, I didn't develop these so much, but it's clear that humor is frequently different in different culture. So there is a huge cultural diversity in our field, and it's very clear that in some cultures, some type of humor do not work simply, whereas in other cultures, this type of same humor type of approach may work very, very well. So I encourage again all of our colleagues and friends to use humor in infection prevention and control so that the message could be more easy to carry and could be more memorable.
Absolutely. Now, humor is, as you indicated, humor is not universally accepted as being humorous. We've
Mhm.
perhaps all had times when we've created something that we thought was very funny and people would find funny, but it met a lot of opposition, even anger, and had to be retracted. Uh, there's really, aside from vetting your ideas with colleagues, is there any way to avoid that trap?
Yeah, it's a very good question. I mean, there is, I mean, some people are really outstanding when they develop humor approaches, and others are not as good. Well, our experience during the COVID time, where COVID was a very serious time, right? It was not. It was not. We were not funny. Everything that was uh, sort of COVID related was not nice. People were dying. We had to promote infection prevention guidelines. We really sort of were pleased to see how much professional humorists could really find the right tone. So be really into the right way of saying things and expressing things. You know, humor is can be really a tool, and to me, humor is a tool. So if you use professional people, if you share with them the right uh, feeling that you want to share with others, usually, of course, professional humorists are really helpful. Now, it's also clear that non-professional people can be simply so nice and so fresh and so good at in their own culture promote right way to change behavior that I will never ignore the important part that these people can play in our daily life.
Excellent. Could I impose upon you to scroll to the very next slide?
Yes,
I don't seem to have control over that with this new
of course,
system.
John. Here it is.
Thank you very much. So I would like to again thank you, Professor Pittet, for another really excellent presentation. I'd like to thank our audience, of course, and of course, our patron sponsors who make this financially possible to Diversity, Envirox, Purell, Gojo, and Gamma Healthcare. Thank you to all of you folk. And I know that all of these companies produce some very interesting and very funny uh, literature and materials that can be used. So feel free to access those resources as well. I hope you will. We have some excellent teleclasses coming up in January, and for the balance of 2023, I hope you'll join some or all of those, and this is a great way to start. So, Professor Pittet, thank you again for this. I know you need to get off to a meeting, so I'll let you go. Thanks again.
Thank you, Paul. It was a pleasure, and I'm looking forward to 2023 as a new, another great year in infection prevention and control. And thank you for the Weber teleclass who are so nice to handle with you. Thank you.
I'm going to end on that note. Thank you very much. Goodbye.